Hey everybody, it's Jamie Raskin, and it is my favorite time of the week, Local Hero. I'm sending greetings to all of my wonderful friends throughout Maryland's beautiful 8th Congressional District and throughout Maryland and across the country. It is time for Local Hero, and we've got a local hero who is doing heroic work, but also really puts the local back in Local Hero. It is our friend Sanjana Quasem. And Sanjana is the director, the lead program manager at the Asian American Health Initiative, which is a part of the Montgomery County, Maryland Department of Health and Human Services. There, she oversees programs that respond to the health and wellness needs of the diverse Asian American communities throughout Montgomery County. Her portfolio of work includes grassroots community outreach, community empowerment, capacity building to lead to sustainable AAPI serving organizations, and over $1.5 million in community grant administration. She was born and raised in Montgomery County. She went to Montgomery County Public Schools. She went to the University of Maryland undergraduate and graduate school. She started as an intern at the Asian American Health Initiative in the Department of HHS in Montgomery County, and she's now the lead program manager. And from that position, she's done really fantastic work in spreading the word about preventive health services and making sure that everybody gets the medical care that they need. So, Sanjana Quasem, thank you for your fantastic work, and you are our local hero this week.
Thank you so much for having me, Representative Raskin. It's my pleasure to be here and to talk about the wonderful work that we do here at the Asian American Health Initiative.
We'll start by just saying a word about the kinds of changes that you've seen from when you started as an intern there, all the way from leading the program today. What kinds of changes have you seen the health initiative go through?
Sure. It's been many, many years since I started as an intern at AHI. And certainly throughout those years, our work has changed just as the healthcare needs and demands of our community have changed. And one of the things that I'm most proud about at AHI is the fact that we've been able to shift and evolve with the changes that we've seen in the population that we reach. COVID-19 is, had such a huge impact on the landscape of healthcare and how we deliver our services. And I'd say that the biggest change in our work really did happen with and after COVID. COVID impacted our communities. What we saw during COVID-19 was that there were a number of community and faith-based organizations that really came up and started doing a lot of wonderful work to meet the needs that they were seeing in their specific Asian American communities. One thing that we always talk about at AHI is that our Asian American community is extremely diverse. It's not a community, but it's actually comprised of about 15 different Asian subgroups in Montgomery County. So we're actually a multitude of communities. So these community faith-based organizations played an incredibly important role in helping us facilitate and deliver health messages to specific Asian American subgroups in Montgomery County. So as COVID-19 and the aftermath of that, as we were dealing with that, what we really saw was that these organizations are doing a fantastic job reaching their communities. So we at AHI really started shifting our lens from direct community outreach to being a facilitator and supporter in capacity building for these organizations.
Mm-hmm.
So now, as you referenced earlier, we have over $1.5 million in community grants that we provide to API serving community organizations. We're supporting them actively in doing the great work that they're doing to reach all of the different subgroups in the Asian American community. So it's really been this shift from direct community outreach to capacity building and sustaining and supporting the wonderful grassroots community organizations that we've seen rise over COVID-19.
Well, and what are those community-based organizations that you partner with to get the word out and to distribute information about different services available?
Sure. So there are a number of different community organizations. We have, as I mentioned, the over $1.5 million community grants. So through and about each year since fiscal year of 2022 in the county, we've been supporting anywhere from like 10 to 15 different organizations through what's called our Healthy Communities Fund grant. And these organizations are reaching a multitude of different Asian subgroups. We have our Vietnamese community, Chinese, we have organizations that are supporting recent refugees from Afghanistan. We have organizations that are reaching out to the Asian Indian population, to also just the Pan-Asian senior group, Indonesian, Korean. So really, our subgroups, the community faith-based organizations that we're working with are serving all of the different subgroups that we see in the county.
Terrific. All right, good. Well, tell us, Sanjana, what message you would have for people listening about what we can all do to improve community health and make sure that everybody has access to the medical care that they need.
Sure, sure. Um, So I'll say that, in the past 3 years, we've seen really tremendous growth in our ability to respond to the specific needs of Asian subgroups. And it's really important to highlight that within the Asian American community, as you mentioned, we're not just talking about different cultures and different racial and ethnic subgroups. We're also talking about different languages, different religions, different, even within one country, you have different subgroups that may speak different dialects, right? So there's tremendous diversity in the Asian American community. And when with COVID-19 and in the years since then, we've seen that actual investment in these communities, both investment in terms of dollars, but also investment in terms of time and energy, and letting communities be a part of the process to build the healthcare system that they think is best for their communities, has really been, I think, really monumental in the way that we've done our work. So instead of, local health departments coming in and saying, hey, here's what you're going to do, giving communities the opportunities to work with the department, giving them the opportunity to direct the way that these funds should be used in their communities, what methods they should use. That has really, had a huge impact in our ability to actually reach more residents and provide them with quality health messages. So I think when it comes to serving communities, it's listening to what they need, giving them a seat at the table to come up with innovative and creative solutions that are going to better serve their own communities.
And that's especially essential in the age of internet conspiracy theories, where
Oh, yeah.
there's so much disinformation out there and misinformation about vaccines and about
Right.
medical attention and so on. And I imagine that's a critical part of your work too, right? Is countering kind of falsehoods that are just floating around the community.
Right, absolutely. I mean, especially during the pandemic, we had so many different community organizations that would share with us, here is the prevalent kind of thought on, how COVID spreads, or here's the prevalent thought on the vaccine within this specific community. And they're different. It's different per community based on, just their own culture or the history that they may have with the healthcare system. So based on all of these different factors, they have different responses and the misinformation is different. And that extends past COVID-19 as well, right? That even now, even just with general health information, every culture and every community has their own beliefs about what it means, what leads to good health. And sometimes, there are it's about, respecting the cultural practices that other communities may have and recognizing that place within just kind of our traditional healthcare system. But other times it's about, combating maybe just misinformation in general.
Yeah. Well, good for you. I know that you've lived most of your life in Silver Spring, which was just rated, I think, the greatest place in America to live for
It's pretty
families.
great. Yeah.
And we all know that to be true, how magnificent it is, along with the rest of the 8th Congressional District. And it's also an extraordinarily diverse place. And so it is important to have that kind of multilingual, multicultural capacity to be able to address what's going on in different people's communities and different people's families. Look, thank you for the really wonderful work you do, Sanjana, with the Asian American Health Initiative and with the Department of Health and Human Services in our county. And we are a great place to live, and we're also a healthy place to live because we pay attention to everybody's health. And I want to thank you for being a critical ingredient and community servant in that process. So everybody, please email her, text her, give her a hug, give her a high five. So everybody, thanks, Sanjana. Quasem for her wonderful work. You're our local hero this week as part of Minority Mental Health Month. Thank you so much.
Thank you.